All right, welcome to our presentation, and thank you for having us here today. We are going to talk about nanorobots and biomedical instrumentation of cancer. And the work we have been developing is collaboration. Of course, whenever you're developing some project that is applied, specifically if it's nanotechnology applied for medicine, it's very important to have multidisciplinary backgrounds from different areas and bring people in collaboration. And as we always mention, of course, the new things, especially related to nanotechnology, is a very challenging topic. And of course, it requires a lot of patience and determination. And for today's talk, we are going to cover things as a computer-aided simulation, which actually provides a tool for prototyping. And we will also talk about some trends in nanotechnology and miniaturization. And at the same time, then in following that, we will jump into case studies, right? And from the case studies, we'll be able to bring some conclusions, all right? Okay, so one thing that people eventually have heard already is computational nanotechnology. And what is computational nanotechnology and what is that used for, right? So basically, we can consider scientific method, and computational nanotechnology is nothing more than an additional and very useful tool for prototyping, right? So basically, we can propose a certain approach or certain solution and investigate a given hypothesis, right? And using the computational tools for prototyping and simulation, we are able to test, of course, using clinical based data, right? We are able to test certain concepts, and of course, from there, we are able to reach some conclusion, right? And of course, this is let's say, ongoing process, right? Meaning that we should always try to redefine what are the, let's say, questions we want to investigate, right? And from whatever model or hypothesis, we need basically to use data, and from that data, we are able to test and reevaluate what are our conclusions, right? So basically, the whole concept, if you want, of computational nanotechnology is actually using what can also be known as scientific computing, right? So scientific computing comes from applied mathematics and computer science methods that actually is used for engineering and biomedical or natural science problems, right? Actually, there are a good reason and motivation for this approach, because what happened is currently we have a broad range of opportunities and trends. And the whole concept is, okay, if we are developing any project, whatever project might be, right? This idea, can we try to visualize it either now or in the coming years to become a product, right? That will, of course, help and improve the life of people, and also bring new ideas to the marketplace, right? And of course, when we talk about applied research meaning that we aim on the long run to transform whatever is the idea into what we can call a new product, right? And as a matter of fact, there are plenty of opportunities for whatever you want to achieve whenever you think in terms of interdisciplinary development, right? And what is the best way to reach this kind of, let's say, development in terms of reaching, let's say, viable conclusion? Basically, the best way is using what we can call case studies, right? So when we, instead of just have a mathematical computational model, instead of just using that concept itself, right? So if we extend it and if we try to basically analyze a real data, right? Like clinical data such as proteomics and cell signaling, right? We can basically use this information for analyzing and provide key conclusions, right? Based on criteria we are using to try to propose a solution, right? And of course, something that you will always need to face is, all right, so the idea sounds good, sounds great. However, hey, can you prove it, right? So, and that's, again, how basically computational nanotechnology is helpful, right? So the idea is, again, you have a subject we want to investigate, we want to do a research on that. We need to be very methodical. We need to define a methodology and approach. We define what are the key parameters or criteria that are required to address the problem we have at hand. And from there, we can, of course, go make, let's say, a clinical data-based simulation, right? We can also use things such as VHDL, right, for hardware emulation. And from there, of course, we are able to obtain data that help us in terms of reaching some conclusion, right? Another thing also that usually people don't realize many times is that some people wonder that or visualize that software and hardware are things completely not associated with each other. But as a matter of fact, actually we should understand that software is very useful even when we are considering a hardware, because the software can be used as a tool for computer-aided manufacturing analysis, thus meaning that it helps us either to completely create and build a new hardware or improve the previously existing design of a hardware, right? So, and when we talk about miniaturization, right? So miniaturization is something that we have seen, right? And basically, miniaturization has accelerated drastically in recent years. And we see that in all areas of, let's say, manufacturing a device, right? So we have this happening in not only in, let's say, electronics, right, but even in robotics, and also in sensors that, of course, can be applied for medicine, right? So based on this trend, right, our team come up with the concept and the idea of, okay, let's investigate what would be the building blocks and what would be the steps required to reach what we can call the miniaturization of robots into nanorobots, right? So what would be the strategies, not only for, let's say, material analysis, sensors, and electronics, but even also in terms of, let's say, control systems, right? And actuation of such device, right? So this is the initial concept and the idea, but then we need to go a step further, right? So in terms of, okay, if we are going to translate that, not only in terms of system, but also hardware, what are the materials, right? What is also the final goal or aim, right? So of course, the final goal is to enable what we can call nanorobots inside the body, right? So, and of course, the application of that are wide, right? Can of course have several different biomedical applications benefiting from this type of development, allowing what we can call clinical instrumentation at molecular level. And when we talk about nanorobots development, this is something that has been going on already for a while, right? Although it's still a very challenging topic of research and development, right? The fact is also that basically there are 4 different approaches when we talk about nanorobots, okay? And our team, basically, we find the most viable approach in terms of real development for application in medicine of such a nano devices using what we can call nanoelectronics approach, right? So basically, we visualize as the most natural choice in terms of implementing nanorobots for medicine, right, for clinical instrumentation, as using nanoelectronics and building up a nano device as a nanorobot using such nanoelectronics approach, right? So, and towards working in that direction, of course, using computational modeling is the way to go, right? So it's very useful, it's very important. And basically, it's just what industries they have been doing for years and years, right? So which is, for example, instead of just going try to build something out of not much of analysis, right, and improvement of design, what industry normally does is they implement several computational models, right? They include all the different parameters necessary to, when they finally go and they decide either, let's say, to build a new Formula One car or build, let's say, a new airplane, right? When we get to that phase, it means that they have improved and tested and simulated many, sometimes even 100 times before they go to the final stage of the implementation. And the same thing applies also for nanoelectronics, nano devices, and nanorobots, right? So basically the concept of using computer-aided manufacturing software is the best way to go. And in terms of nanoelectronics, right? So as we have mentioned, we consider using approaches such as CMOS, right? And basically we see that CMOS is, let's say, continuously shrinking, right? From, let's say, a 10 nanometer size functionality and recently 5 and 3 nanometers, as have been reported recently. And the whole idea, right, so again, is that we can use the same type of integrated circuit, not only to achieve what we can call as a nano sensor, but also actuator, right? And the same approach also can be used for, let's say, communication, data tracking, right? And positioning of the nano robot or nano device, right? Of course, to reach even more effective, let's say, heat dissipation and also improve, let's say, performance of devices, we should continue improving and analyzing materials and approaches for manufacturing, right? Such as nanowires, nanotubes, and nanophotonics that allows higher performance of devices, right? And of course, using the electromagnetic propagation waves help us also not only for positioning and tracking the current position or where the robot is located inside the body, but also in terms of using it for the integrated sensor and circuit instrumentation, right? So basically, there are, of course, a lot of excitement about developing such nano devices as nanorobots, and the reasons are quite obvious, right? Because chances are higher and also even profits in terms of possible applications of nano devices, nanorobots for medicine, right? And of course, using computer-aided design, or also some people may call it 3D modeling and virtual simulation, is a quite powerful tool. One thing to keep in mind is that there is a difference between purely visualization, 3D visualization, and physically based simulation, right? So the physically based simulation, which is what we do, is when you not only go through the process of rendering and visualization of whatever model you have at mind, but also you go and you add all necessary physical parameters, such as, let's say, electronics, radio frequencies, signal, electromagnetic dissipation, and even, of course, the proteomics gradient change within the human body, which basically is from where we have the terminology, which is physically based simulation. We are doing not only visualization, and thus such a approach using computer-aided manufacturing analysis and simulation provide us the ideal tool, right, as an applied research development we are doing using the computational technology, right, for actually investigate what we call case studies, right? So, and that's what we did and we are doing to foster the further and faster development of nanorobots, right? So one of the case studies our team has implemented is exactly nanorobots for cancer, right? So in terms of application of nanorobots for cancer, we can see it specifically use it for surgery. We can also see it for drug delivery and even for early diagnosis, right? So basically, the idea is you go, you apply as pretty much as a blood-borne floating with the bloodstream nanorobot sensor, and from there we are able actually to detect what are considered protein overexpression that are related to cancer or tumor development, right? So we have things such as the MIC gradient, and basically whenever you have, even if it's an early stage of development of cancer with a small tumor, we have already observed that there are significant growth of a MIC protein overexpression within the bloodstream, right? So and this of course can be used not only for basically detecting the cancer itself, if you have a patient with a tumor, but also, most importantly, it can also be used both for surgery in terms of, let's say, cancer tumor and cancer materials, right? You can use this information for the cancer mapping, which is useful for surgery and extraction of any tissue that are cancer related from the patient, but also it helps us in terms of fighting and avoiding any spread of the cancer before metastasis happens, right? Which is very important. And the whole concept, right? So as we can see, once the nanorobot goes closer to the tumor floating with the bloodstream, the sensor will be activated, sending through the MIG signal transducing the signal for the system that, of course, noticed that the sensor was triggered, right? And a signal was sent detecting the MIG protein overexpression, right? So, and of course, we also consider what would be possible positive negatives, right, within the bloodstream, and that's why we consider that only when we reach a certain threshold is when we consider that, okay, this patient really actually has the case that, as a matter of fact, the person has a higher probability of have already tumor in early stage of development, right? So, and basically also in terms of, let's say, collective swarm, we have using this approach with the nanorobots, which many consider it as a swarm of sensors actually searching for pathological signals, right? Okay, so again, the whole concept of using computational nanotechnology or computer-aided design manufacturing analysis is a very effective approach, right? So, and again, this is what has been used for industry for many years, right? So, of course, in a very effective way, right? That's why, of course, again, computational nanotechnology, or if you prefer, physically based simulation, is a very effective way to go, right? So another study case we have implemented also is investigating nanorobots for cardiology, right? So cardiology is also a widespread health issue, right? All over the world. And of course, using nanorobots can be useful, can be helpful for drug delivery, right? Also blood pressure and even other problems. And even, let's say, the obstruction of coronary artery, right? So here we can visualize how basically change of temperature is a high indication of when someone has a heart problems, right? Has a coronary atherosclerosis. But of course, even more remarkable is the protein overexpression, right? So the VCAM1 chemical signal or protein overexpression is, of course, highly noticeable, right, when you have in the artery an occlusion, right? So, and this information is also, again, useful for the nanorobot instrumentation and also for sensor manufacturing, right, material analysis. And the other study case we have implemented was also for diabetes, right? And of course, diabetes is a health problem that has many patients, right? And of course, the nanorobots can aid in terms of continued glucose monitoring, right? And this, of course, could be used and integrated with a cell phone in terms of whenever the patient has, let's say, the glucose levels that needs to be corrected, right? And trying to keep it inside certain ranges, then the nanorobot basically will send a signal to the cell phone. The cell phone goes and inform the patient that the patient needs to take action, right, to control his own glucose level, right? Okay, so the other application or study case for nanorobots basically is using it for defense, right? So basically, this other study case we did actually, if you wish, right? So we can also visualize it, even applied for COVID, right? Which basically was using nanorobots to detecting influenza before an outbreak could happen, right? So basically, the whole concept is we proposed, let's say, long distance monitoring platform that integrates basically the nanorobots within the person, especially for when you have like a war zone, right? That might be very interesting for military personnel, right? Trying to avoid eventually that someone get infected with some biohazard, right? And basically, the person has the nanorobot injected in his bloodstream. The nanorobot goes through the bloodstream, searching for, let's say, pathological protein overexpression. And when such a protein is detected, right, specifically for influenza is alpha-NAGA protein, then the nanorobot sends signal to the cell phone, which of course in turn sends this information through satellite to the headquarters, right, and to the personnel. And based on this information, right, the team decides what is the best path to take, right? Of course, the whole aspect, right, for let's say such a pandemic situation is exactly trying to avoid a pandemic outbreak, right? So that's the most important. And again, the nanorobot in our computational modeling is always activated whenever the protein overexpression within the bloodstream reach certain levels. And again, we also apply the approach to avoid false positives, right, with predefining a number of signals that should be sent by a number of nanorobots in order to define that, yes, indeed, we have a first case, right, or a case zero of, let's say, influenza, right, or any other biohazard or, let's say, contagious disease, all right? Okay, so of course, again, possibilities and also benefits from nanorobots applied for medicine, right, are, again, very wide, right? And that's why also it is a very, I would say, topic of interest with a growing interest, all right? So the other study case we also implemented was for brain aneurysm, right? So basically, brain aneurysm is a health problem that can be easily cured. However, the biggest, let's say, challenge for a brain aneurysm is that many times the patient with a brain aneurysm has no idea that he has a brain aneurysm, right? And when exactly his doctor find out is when it happened that the patient basically had the stroke, right? So, and that's what we should avoid at all costs, right? So, and that's when we see that nanorobot can be applied, right? So basically using information from the genome mapping, right, from the chromosome 12, we can associate a specific antibody agent to basically propose the biosensor that actually is effective for analyzing and making the early diagnosis if someone has the brain aneurysm, right, in development, right? And of course, all the information we put in our 3D modeling and simulation is using clinical data, right? That we, of course, we were blessed with all the collaboration we have established, right? And again, this is a major factor, right? So if you're doing a 3D modeling and simulation, especially if you're considering, let's say, either the instrumentation or the, let's say, prototype manufacturing materials analysis, it's very important that you add up to your 3D model all the necessary materials, right, and also use clinical data, right, basically to back up the model, right, that you are working with. All right. So, and for the brain aneurysm, right, so basically the protein NOS, or nitric oxide synthase, is the one that provides us the information that yes, this person has all the, let's say, characteristics that eventually this is a case of early development of brain aneurysm. All right. And again, possibilities for investment, and also for, I would even say, further implementation and commercialization of nano device is huge, right? So no wonder that, again, developing nanorobots is a topic of such interest, right? And again, because the possibilities of implementing and applying it is huge, right? Of course, it's not an easy topic, right, to work it, either academically implementing a model or even commercially, right? So because that would be required to go through the FDA, right? But again, the key for success is determination, right? So, and this applies to anything, right? So not only for nanotechnology, but also for any other areas, right? And again, that's very important that we visualize the long-term, right, objective, right? So which is, on the long term, have people collaborating, right, working together towards the good, right, of society. And then, of course, if you wonder, or if you ask what would be the conclusions, right, that we reached through all the development we have done, implementing nanorobots, prototyping and modeling and simulation for medicine, we would say that basically three things our team come out, right, with a conclusion, which is, first of all, yes, nanorobotics is a very challenging topic that requires determination, right? So the other thing is also that is very important is, of course, we need to consider and visualize that it's very important to bring people together, right, from different multidisciplinary backgrounds into collaboration, right? So that's very, very important, right? And the third thing, of course, is to never give up, right? So we need to have a long-term vision, right? So if we want to change, let's say, technology for the better for tomorrow, we need to have, again, a long-term vision. We need to keep working, right, hard, and let's say, one implementation after the other, right, be able to reach some conclusions, right, and of course break a new, let's say, boundary, right, in terms of reaching new levels of implementation, right. So currently our team basically has a collaboration with many partners, right, even from industry, and also, of course, as you know, from the medical field, right? And the long-term vision is that we will continue implementing and working towards nanorobots for medicine, all right? Okay, so what we have covered in today's presentation, right? So again, we have discussed about computer-aided simulation, right, as a very useful tool for prototyping, right? Of course, we discussed about some trends, and even then we jump into case studies, right? So how and why case studies are so important, basically because these provide us all the necessary information to basically pave the way towards instrumentation, analysis, manufacturing, and even future application of nanorobots in medicine, all right? So, and of course, in the end, we came to the conclusions, right? Which, again, nanorobots is a topic of interest and, of course, challenging subject to work on, right? But that, of course, what we need is to have long-term vision and determination, all right? Okay, so of course, things are always changing, right? Especially in technology, right? And it is always worth keeping an eye, right, on what are the trends and what are the possibilities, right, in terms of development, all right? Okay, so I hope you have enjoyed the presentation, all right? If you have any question, it will be my pleasure to answer any of your questions, right? And of course, thank you again for your interest, right? And have a great day. And as I always say, right? Remember to stay awesome, right? And be nice to each other.